Good morning, fellow Toastmasters, and welcome, guys. I welcome you all to another exciting meeting at Sattvic Toastmasters Club. My name is Toastmaster Amar. I'll be the sergeant at arms for today's meeting. At Sattvic Toastmasters, we strive to inspire personal and professional growth, all while embracing a holistic approach to living. It is wonderful to have you all here to explore this week's theme. Before I start the meeting, I would like to mention three ground rules we usually follow at our Toastmasters meetings. As a Toastmasters, we don't speak about sex, religion, politics. To speak, refrain from discussing these topics at an extent. Please put yourself on speaker if you are speaking. Otherwise, put yourself on mute throughout the meeting. And I encourage you to on your camera throughout the meeting and turn off your video if you are stepping out of the meeting. Kindly rename yourself with role prefix to your roles for role players here. If you are a guest, may I request you to put guest in front of your names. As in everybody in their lives have a mission to achieve, likewise our Toastmasters Club also have a mission. The mission of our Toastmasters Club is to provide a supportive and positive learning experience in which members are empowered to develop communication and leadership skills, result in greater self-confidence and personal growth. With this, I announce this meeting as open, hand it over to the stage to our presiding officer today, Toastmaster Ishita. Ishita Patnaik has worked in the corporate world across India and United States. She has been a Toastmaster for more than 3 years now and lives in Bhubaneswar, Odisha. She is passionate about mental health, self-development, and wellness, and she loves to speak on these topics. Please welcome our presiding officer for today, Toastmaster Ishita.
Thank you, Toastmaster Amarnath, for this wonderful introduction. Good morning, good afternoon, good evening to all my fellow Toastmasters and dear guests from whichever part of the world you're joining. A very warm welcome to yet another exciting episode of Sattvic Toastmasters. As the name suggests, we at Sattvic are focused on healthy lifestyle, but at the same time, we also focus on communication skills. Communication and leadership skills, skills that will benefit you a lot in your personal and professional life. Our motto is not just health, communication too. Sattvic Toastmasters is an online club where we focus on leading a Sattvic healthy lifestyle, self-healing, research and debate on alternate medicine, interculture experience where members from different parts of the world get a platform to safely discuss their views and opinions. Interpersonal communication, storytelling, and critical thinking. We are so proud to celebrate Health Awareness Month in the month of April, and we have an exciting lineup of doctors who are going to come to Sattvic and present their learnings and educate all our audience. Before we get started, though, I would like to welcome all our guests who have come here. We have our guest, Dr. Sujata Mittal, who is already there with us in our audience. She'll be introduced in a little bit by our Toastmaster. I'd like to say hi to our other guests who have come again. Toastmaster Ganesh, would you like to say a few words? You're joining us for second or third time, right? I'm not able to hear you. Okay, we are having difficulty hearing you, Toastmaster Ganesh. I'll get back to you a bit later. We have guest Uma with us. Would you like to tell us a little bit about yourself? Okay.
Hi, am I audible? Am I audible now?
Yes, Ganesh, go ahead.
Yes, so I saw the flyer of the meeting today regarding some health awareness and some talk on health awareness. So I decided to join the meeting. Sunday
Yes.
I am off, so I'm looking forward to great learning and meeting forward. Thank you.
Wonderful, wonderful. I hope you get a good takeaway from the meeting today, where we have our speaker, keynote speaker, as well as our interesting lineup of session. Guest Deep, would you like to, I think you are coming for the first time visiting us. Would you like to unmute and tell a little bit about yourself? Okay, there is a problem with the audio, I believe. So without further ado, I would like to now proceed with the Toastmaster session today. I'm going to introduce the Toastmaster of the day, who's the dynamic and dashing Adi. She recently completed her BBA and is going to pursue her MSc in Technopreneurship and Innovation from June at NTU Singapore. Currently, she is preparing for GMAT exam and focusing on improving her skills and becoming a better version of herself. Please give a huge round of applause for Toastmaster Adi Lakshmi. The stage is yours.
Thank you so much, Toastmaster Ishita, for your kind words. Greetings of the day, fellow Toastmasters and guests. It's my honor to be your Toastmaster for today's special meeting, where we are celebrating Health Awareness Month, a time to reflect on our well-being, adopt healthier habits, and raise awareness about the importance of taking care of our physical and mental health. We're observing this April as Health Awareness Month to spotlight different health issues, raise awareness, and encourage people to prioritize their health. This month serves as a reminder for us to assess our lifestyle, be proactive about preventive care, and make informed decisions about our physical and mental wellness. Whether it's promoting exercise, nutrition, mental health, or the importance of regular checkups, Health Awareness Month is all about fostering healthier communities. Before we welcome our special guest today, I would like to invite our general evaluator, Toastmaster Shahid Sheikh, to introduce himself, and his tag team.
Thank you, Toastmaster of the Day, Toastmaster Adi. Thank you for giving me this opportunity. And hi, good morning, good afternoon, and good evening, whichever part of the world you are joining. I am Toastmaster Shahid, and today I am the general evaluator for this meeting. And to run our show smoothly, we have some role players which are very crucial, which will tell us time to time from the timer and our language perspective, grammarian, and the usage perspective, the R counter. These are the three roles we have. Now I would like to call upon our timer Bharadwaj. Timer Bharadwaj, could you please explain your role?
Yes, sir. Yeah, good morning. Good morning, fellow Toastmasters. Myself, Bharadwaj. So, I am from Evolve Toastmasters Club, Bengaluru. It is a corporate club. Coming to my today's webinar, have an importance for our health.
Bharadwaj, we could not hear you. Hello, Bharadwaj, are you there? Okay, some network glitch it seems. Okay. Okay, maybe by the time he's back, maybe we'll move on to the next role players. We have two other roles, grammarian and R counter, and we have a well-known Toastmaster Vikram Prakash. So I would like to call upon Toastmaster Vikram to explain his both the roles.
Thank you, Toastmaster Shahid, and greetings everyone, my dear Toastmasters and guests. Before I begin, can I have the sharing rights?
So I gave rights for everyone to share. Can you check if you share now?
All right, I'll try that. Sure. Yes, I'm able to share. Thank you. All right, so as a grammarian for today, it is my responsibility to pay close attention to all the speakers, and I'll be listening carefully to their language usage, and I'll take care of any important language usage as well as any outstanding words, quotes, sayings, or thoughts which are being presented during this meeting. As a grammarian, it is also my duty to introduce the word of the day as well as the idiom of the day. I hope you can see my screen. Is my screen visible?
Not yet, Vikram.
All right.
Maybe. Yes, now we can see.
Can see my screen. All right. So the word of the day for today is invigorate. What does it mean? It means to give strength or energy to energize or refresh. Example, a brisk morning walk can invigorate both the body and the mind. So can I have one of the people here in this meeting today to just try a sample word of the day in your sentence? Can one of you come forward?
I can try.
Yes, please.
This session of Sattvic Toastmasters has invigorated me with new energy.
Okay, that's great. Thank you, Ishita, for coming forward and using it. I hope now the usage is clear. Next, let's move on to the idiom of the day. So the idiom of the day is fit as a fiddle, which means in very good health, physically fit and well. Even at 70, my grandfather is fit as a fiddle and goes for a jog every morning. Now, who wants to come forward and try this idiom of the day?
Let me give it a try.
Yes, please.
I
Toastmaster.
feel fit at a fiddle. I feel fit as a fiddle and invigorated joining this meeting of yours. Thank you.
Thank you so much, Toastmaster Manoj, for using both the word and the idiom of the day. And with that, I'm now going to explain about my second role, which is the R counter. So as an R counter, it is my responsibility to pay close attention to all the speakers. I will be listening carefully to your language usage. If I note any improper language usage and use of any crutch words or any past filler words in your speech, then I will be noting it down. During the meeting, I will also be listening carefully for any overused words, including and, but, so, and you know. I will also listen for any filler sounds, including and I will also note when a speaker repeats a word or a phrase such as I, or this means more than once. At the end of the meeting, I will report the number of times each speaker has used these expressions. Thank you. Back to you, General Evaluator.
Thank you, Toastmaster Vikram. Thanks for taking up the double role. And I hope these double roles invigorate today's session. Yeah. With this, I would like to call upon our next newly introduced role, that is a listener role, that is Satya Sarika. So I would like to call upon Satya Sarika to explain her role.
Yes, thank you, General Evaluator. Greetings, fellow Toastmasters and dear guests. I am Toastmaster Sarika from Kite Toastmasters Club. Today, my role is to keep observing and paying attention to all of the meetings, and I'll be back with my with funny questions, which will testing your listening skills and attention. And I want to say one thing: everyone are listening to give reply, but no one are listening to understand and getting their feelings. So I want to challenge you. Please listen to understand, not to give back a reply. Thank you, and over to you, General.
Thank you, listener. That is a thought-provoking sentence which you have given. So we'll definitely try to listen to understand. Okay, so maybe the timer was dropped. Ganesh, are you there? So can you quickly check your audio, video, and as well as your timer cards?
It's Bharatwaj.
Sorry,
Yeah.
Bharadwaj.
I'm back.
It's
I'm
my
back.
yeah. So can you please rename yourself as timer? And one more thing is, can you please explain your role once again? It was dropped in between.
Yes, actually, I'll be changing my background colors. I will adjust my background. At the before 5 minutes, I'll turn it to the green, and at the time of 3 minutes, half minute for closing, I'll be changing it to yellow, and at the end of the time, I'll be changing it to red, and I'll keep that red until the speaker finishes the meeting. For prepared speeches, the time limit is 5 to 7 minutes, and for table topics, it is 2 to 3 minutes. For evaluation speeches, it will be 3 to 4 minutes. Thank you.
Okay. Hope you received the timings for the keynote speech.
Yes.
Okay. Okay, then, so our team is ready to sail the sea. So I will hand over the baton back to our Toastmaster of the day, Toastmaster Adi. Let's have a great meeting.
Thank you, Toastmaster Shahid and team, for invigorating all of us to a great energy and for the great start. Thank you so much. And I would like to once again, to help everyone, I would like to say the keynote speech, green card will be raised at 20 minutes, yellow card will be raised at 25 minutes, and red card will be raised at 30 minutes. And after that, we'll be having questionnaire session. I hope everyone will of you make use of this keynote speech and gain knowledge. With that, we're going to start this month with cancer prevention. We are extremely fortunate to have an expert with us today. Our keynote speaker is Dr. Sujata Mittal, a senior gynae oncologist with experience of 35 years in the field of gynae oncology. She was trained at Kidwai Institute of Oncology at RCC, Bangalore. She's preventive oncologist and master trainer for gynecologists from all over India. She has won many awards for best paper presentation in different gynecological conferences. She was awarded the Alwar Woman of the Year in 2014. Without further delay, please join me in welcoming Dr. Sujata Mittal to the stage.
Thank you for such a nice introduction. I'm really obliged. Thank you. Am I audible?
Yes, ma'am. Are you able to share your screen, ma'am?
Yeah, let me check it just now. Yes.
You can see your screen now, ma'am.
Yes. Just a minute. Just a second. I haven't done one thing. Let me do it again. Is it visible clearly to everyone?
Yes, ma'am.
Okay. First of all, I'm really obliged to Ishita, Toastmaster International Club, for inviting me, for giving me the opportunity to speak to all of you. This subject of oncology, especially the preventive oncology, and what a general person or a common person can do in their life to prevent and treat the cancer, is very important and dear to me. So I'm really obliged to Toastmaster International again for giving me this opportunity to interact with you. So today's lecture is about redefining cancer treatment, how we can prevent it and treat the patient, ourselves and our family members. It's an oncologist perspective. In a life where the technology has taken over in a very big way, we have stopped paying attention to the small things in our life, which really can pave the path to our future, can create a better future, can create a better environment for us. So I have learned at a very late stage in my life, at the age of around 50 to 50, between 50 to 55, that the things which are really near, very dear to me, which I was and I used to be passionate about, I have missed them in my life, because of my work, because of my competition and lot of other things. So first of all, the foremost, I request everyone that pay attention to the things that you are naturally drawn to. We have seen children that some of the children, they like playing with the frog. Some of the children, they feel comfortable sitting with the elders. Some of the children, they naturally are drawn towards the satsang. So let's draw our attention to the things which are really natural, which are coming natural to us, because these are often connected to our path, passion, and purpose in the life. And now coming to the exact topic, we are what we eat, what we exercise, and what we meditate. Meditation doesn't mean sitting and thinking or thinking about what we are doing or what we are meditating. It is exactly what we are thinking about. And to tell all of you that our body is a miracle house. It has got the miraculous way to heal itself, to replenish itself. Our blood cells, especially the RBCs, they replenish or they are renewed by the end of 3 months. Our liver is able to regenerate itself by 6 weeks. That is why the liver transplants are being done. Our bones are able to make a new skeleton within 3 months. Remodeling of the bones takes place. So let's utilize this amazing capacity of the body to use it, to replenish it, and to make a newer and healthy body. And again, cancer as a disease, it's a tap on the shoulder to tell us that our choices matter. What we put in our mouth, what we put in our plate or in our mind, and how we live, that matters. And what profession we choose, that matters. Because as I just now told you that I chose medical and I left so many things because of the competition, because of my goals, plus whatever the workload did me. So all these things, what we are eating, what we are doing, what we are thinking, whether we are exercising or not, these are creating the imbalances, which are environmental, which include the diet, nutrition, including air and water. Water and air are very, very important components of our imbalances. Lack of exercises and the trauma being which is processed by the mind, body, and spirit. And then the lot of research is going on the circadian rhythm, whether we are getting up in the time or not. Our lives are synced with the moon and sun cycles. Women's menstrual cycle is directly linked to the moon. The cycle of the moon is around 28 days, and our women's cycles are also 28 days. And then finally, our prarabdha karmas, our genetic predispositions, our attitudes, and our beliefs, all these are leading, they can lead to the imbalances and hence multiple diseases, including the cancer. So before I go to the exact topic and how we can prevent and all those, I want to show my previous pics when I was around 35, between 30 to 40. You can easily make out the stress has taken toll on me. And when I started realizing that something is missing in my life, because always hectic, 18 to 20 hours working and getting aggressive for every smallest thing on the children in the operation theater, I started, and always my pulse rate used to be 190, between 90 and 100. And always thinking with the thinking brain, I started realizing that I'm missing something and I was falling prey to multiple problems beside aggressiveness, like I developed osteoarthritis at a very young age. So after started looking into the life, I joined Isha Foundation. I learned what is asanas, how do they change your mind. I learned about the meditation, Shambhavi Mahamudra, and you can make out something about the changes in my face. So face your, once anyone comes to us, my habit is to look at their hair, to look at their face, look at their skin, how they're walking. That gives a lot of diagnosis. So explaining you about how your environment affect your predisposition to different diseases, including cancer. I want to show you one study. This is nuclear transfer studies, because a lot of people, initially in medicine, we were taught that it is the genes which are responsible for giving you the diseases. Now it is the epigenetics that is above the genes, your internal environment. So here if we say this is a normal cell, this is a cell, this is a nucleus, this is cytoplasm having mitochondria, Golgi body, this is a tumor cell. So green is normal, red is abnormal. This is a tumor cell. So what they have done in the nuclear transfer studies that they took a normal cell and replaced the nucleus with the abnormal nucleus. When this cell divided, the genes were the same, but the healthy normal cells were produced. And in another experiment, they took the cell in which the nucleus was absolutely normal, means the genetic material was absolutely normal, but surrounding area, that is the cytoplasm, was abnormal. It was acidic or whatever you can say. Then when this cell divided, it formed the tumor cells, and they died, because of course the tumor cells, they cannot live the way they should have been living, like a normal cell. So there's a lot of debate between the nature versus nurture. So it is now said that our environment, our upbringing, and life experiences determine our behavior, and our behavior is responsible for multiple diseases. It has been also found very clearly in many studies. This is the New England Journal of Medicine in 1988, where in America, because the unmarried women are having children before their marriage, and they leave their children for the adoption. So it was found that the children, those who get adopted and their parents had died of cancer, those children, they didn't had any malignancy, they didn't had any cancer. But if the adopted parents, they had cancer, then these children were prone to develop 500 times. The chances of development of the cancer was almost 500% increase. So what does this indicate? That your atmosphere, the living environment, and how you are brought up, they all play very important role in the formation of the diseases, including hypertension, diabetes, cancer, autoimmune disorders. So this field is now called the epigenetics. So what right now the medicine is doing, that we are diagnosing the patients at this stage, progression to frank disease, where patients comes in the 3rd or 4th stage, and they're having metastasis. And finally, we are treating the patients. We are not giving long-term results, means 5-year survival rate in different cancers is different. We are not giving good prognosis to the patients. So this is the latest of the medicine. But what does the epigenetics and the preventive oncology teaches us? That we should be diagnosing the patients here. For example, if I give you the example, suppose any female who comes with the PCOD, I know that she's going to have infertility, she's going to have the fatty liver, she's going to develop the diabetes, hypertension, depression, because of the obesity, and later stages, she can have the breast cancer, she is prone to develop the uterine cancer, and if she undergoes the IVF, the chances of the ovarian cancer will go. So this is now epigenetics. Once you have come to know that this particular patient is having this particular problem, we are aware that we have to guide this person accordingly. In fact, it should start when any child should come with the obesity, especially I'm talking of obesity, or they have got the abnormal behavior like smoking, alcohol intake, because this has now become very common even in the young age. So as soon as a child comes with child means between the 10 to 15 years of age, normally in my case studies, I see the girls in between this age. So if suppose any girl comes with the obesity, I know what problem she is going to develop. So we should, as a doctor, we should start guiding our children, our patients, when first time they come to us as a teenager. So preventive oncology, or with the help of epigenetics, we can reduce the chances of chronic diseases by almost 80%. So again, what is health? Health is the balance between physical, mental, emotional, and spiritual. WHO has already defined health as a balance between all these 4 fields. And what are the root causes of a disease? From now, whatever I have explained to you, it must have been understood that there are poor diet, infection, toxins, lack of exercises, all these lead to nutritional deficiencies, hormonal imbalance, and along with the sensitivities and allergies, neurotransmitter imbalances, we develop the mental, spiritual, and emotional factors. Because whatever we are eating, जैसा खाओगे तन वैसा होगा अन्न, जैसा खाओगे अन्न वैसा होगा तन और मन. This we have heard from ages. But in medical, in our allopathic system of medicine, we are not taught about the diet, about the nutrition at all. The body is considered to be like an engine. You oil the engine, you take the diet, whatever you want to take, and then you can manage the diseases with the medicine. But this is not the case. Every oil needed by the different engine is different. So if whatever we are putting it, according to the behavior of that particular machine, we need, that will be the outcome. So body is a chemical vessel. If we put the garbage in, we will get the garbage out, whether it is a diet in the form of diet, thoughts, emotions, and our spiritual activity. So what are the signs that you have got the toxins? That one is the lasting fatigue, constipation or irregular bowel, bloating, blackening of the skin of the face, on the back or the arms. If you are not able to concentrate, or we are having the brain fogging, which is very common after COVID, sugar cravings, achy joints, puffiness of the face, hair fall, dandruff. All these are the small, this is a very small list, but there's a huge list. But common symptoms I have enumerated here, which we can rely on and take it that something is really wrong with us. So what we do in the prevention and reversal in the modern medicine, and along with our alternative system of medicine, that we try to balance all the levels of the body, that is physical, mental, spiritual, and emotional. That is called the koshas in Hindi, or Ayurveda, or planes in the medical language. And we try to neutralize the acidity or balance the pH of the body. And with this activity, we raise the human consciousness and we expand the horizon of the human life. So what is the mantra? The mantra is today is that we have to detox. What is, people are able to understand detox very easily. So it is a physical detox, mental detox, emotional detox, and spiritual detox at every level. Once a person comes with any disease, especially because we are focusing on the cancer. So when the patient comes with a cancer, we need to detox at multiple levels. So coming to the physical detox, we focus on the diet, foods to be avoided, what is the condition of the gut, what is the importance of fasting, what is the importance of good sleep, and how to avoid the toxic exposure. Then what are the need of the supplements, and how to maintain your gut clean, because all the diseases, they start with the gut. That is what the medical science is now saying. And medical science is saying that gut is the second brain of the human body, which our ancestors or our sages knew beforehand only. So when coming to the diet, as I said, we cannot run our expensive diesel, expensive diesel car with the petrol. As I was telling, whatever particular engine requires particular diet or the oil. So similarly with the body, the efficiency of the engine will decrease if you put in a diesel car of petrol. It will run, no doubt. We are also running, but we are having lot of hitches and glitches. And that's what exactly with the machinery happens. So diet is a recipe for the preventing cancer, all other chronic diseases also. It is also a recipe for preventing recurrences and help to reverse the cancer and the diseases. So what is the diet in basic nutshell? We see all over the world, the different countries, they have got different culture, they have got different perception, they are treating the disease in a different way. So here I'm talking of India, which is a tropical country. Here we advocate whole plant-based nutrition, which is organic, because lot of toxins are coming from the food, because in food, in agriculture, pesticide, fungicides, preservatives, all these are being used. So we are getting lot of toxins from the food. So that is why organic. And we advise that we use less jaggery, no refined items, and the way the animals eat. It is not like that exactly the way they eat, but mostly. So what they do, they don't cook the food, adults don't drink the milk, and they don't take oil. We take out the oil from the mustard seeds, and we use the oil, but the remaining residuals, we give it to the animals, to our cows and buffaloes, and they remain healthy. So I'm not saying that you should not take the oil, minimize the oil once we are having the problems. And if we are using as an adult, healthy adult, if we are using oil, we have to exercise so that that oil is being utilized properly. What are the do's and don'ts? See, the topic of the diet is very vast. It will take around small things that take around 3 hours to explain. So I'm focusing on the most important things. We advocate and advise to avoid microwave, aluminium, non-stick. We advise that one should not eat after 8 p.m. Stop using the plastic storewells and use the neem and turmeric. Neem is antifungal, antiviral, antibacterial, and has got around 120 properties. In 2021, I think it has been named as a tree of the world. So diet in cancer, it helps, it improves the quality of the life, it increases the longevity, it gives you empowerment, and it prevents the recurrences in simpler terms. Then coming to the emotional detox, we are what we make the choices. And when we make the choices, it all depends upon our emotional state. And our feeling changes our interior milieu. Everyone very well knows that when we are angry, our heartbeat, heartbeat starts running very fast. We start perspiring. So at that particular time, the decisions making capacity decreases a lot. We are producing a certain type sympathetic system gets overstimulated. And when we are calm and peace, parasympathetic system that takes place, and we are happy and we let go of the things, whatever, when we are happy. The same thing happens when we listen to the music. When same thing happens when we are following passionately our choices. For example, if I love doing dance, I'll forget at that time what I'm doing. So choices we make depend upon our moods, our emotions, and that changes our intracellular internal environment. And once your internal environment is imbalanced, if you are repeatedly getting angry, we are shouting, we are becoming aggressive, the whole internal environment changes, and it start causing over the time the changes in the cell, which can lead to the mutation. So, and all these things, again, it depends a lot upon our prarabdha karmas also. I'll come to that. But mental and emotional detox, we need to do exercises. And for that, we advocate right now, after learning from Isha Yoga, that the asanas are best. Power yoga has killed many. So power yoga or powerful exercise, going to the gym is not good for the health. So asanas, they bring about a certain balance between the parasympathetic and sympathetic system. It harmonizes the body properly. So for girls especially, I advocate Surya Namaskar. Then we need to adopt certain tools to relax our mind. For example, I'm doing Shambhavi Mahamudra and Shakti Charana Kriya. Then we need to see, it is very simple to say, do it or resolve the conflicts or you stop negativity. But then we have to adopt certain tools, which I just mentioned. So depending upon your choice, lot of things, Landmark is conducting certain programs to resolve the conflict, to resolve. It's not about others, it is about us. So we need to follow certain tools. And then the spiritual detox is about the meditation, bhakti, developing concentration, gratitude, affirmations, and definitely the charity. As I was telling, that our prarabdha karmas, which are the samskaras, these are the impressions left by our previous births, by our genes, by our thinking also at the subconscious mind. From where does the thought come in the mind? From where does we start thinking that we don't remember exactly sometimes that which particular thought, why it has come and why it has come to us. In sleep also, why the dreams had, peculiar dreams had come to us. So all these, our cells have got their subconscious memory. They remember around, it is said that 7 past generation. And then that needs to be, if we want consciously to change certain negative things, we need to do selfless service, charity. And as I told, these are samskaras are also present karmas which we are doing. So these are the some of our present karma. And these samskaras can be only purified by the prayer, contemplation, meditation, selfless service, and satsang. That is why where you are living, what environment you are living, what environment you are giving to our children, whether they are sitting with the bad people or they are going to the satsang or they are playing only or playing with the mobile only. All these matters, and hence we need to pay attention to ourselves, to our family, to our environment in the home also. So this is a cycle of the karma. We do the action that leaves the impression, that then it becomes a vasana, and then it becomes a thought process, which is called the vritti. So if we want to change, and especially in the when we are suffering, then we have to create constantly in mind what we want to actually do. What we have to leave the thoughts which are bothering us, and we have to create a new thought pattern which is healthy for us. We have to, it is again, I'm focusing and telling that it is very easy for me to say stop resentment, stop irritation, stop anger. That is why we need to adopt the different tools so that my sympathetic system that stops telling us repeatedly what has happened to us. Now, as I told, I think earlier, that circadian rhythm, moon cycles, sun cycles, now it has been very, very clearly founded by the science that at particular time, particular hormones are released. If you see from 12 a.m. to 6 a.m., this is the time when most of the hormones, that is thyroid stimulating hormone, growth hormone, melatonin, bone remodeling, prolactin, acetate, all these hormones are being produced. Melatonin is being produced by it is get secreted by the brain around 9 p.m. and by 6:30 it stops producing. And it is also observed that the highest blood pressure, there's sharpest rise in the blood pressure around 6:45 a.m. when we go to the bathroom. So the elderly people, those who are hypertensive or stress prone or having the cardiac issues, when we strain, there are maximum cardiac collapses that occur during this time. So we have to maintain a balance between the circadian rhythm. What we are finding that the most of the time, people coming to us, they are getting up around 8 o'clock. So as I told, body is a chemical vessel. If you are sleeping by 8 o'clock, even by 7 o'clock, and sun is already there in the sky, your body has already stools and urine, and it is a chemical reaction. What sort of the reaction do you think the body is going to make? That is why in India, we had always culture to getting up at least 40 to 45 minutes before the sunrise. We need to clean ourselves so that our body is receptive to the sun rays and vitamin. It's a small example that vitamin D is being produced by the sun. All, if you see the glory of the sun in the morning and do the say the Gayatri month at that particular time and visualize the sun, which is just coming through the horizon. It's a beautiful lot of things like emotions, what we are absorbing, not only the thoughts, not only the sun energy, but our whole system gets invigorated. So this is the power of the coming sun coming and showing its face to us. So a lot of studies are going on circadian rhythm. If we are sleeping by 2 in the night and eating 12 o'clock, we are going to have the problems. We are going to have a diseases like cancer, because throughout the day we are eating. Right now, the present man is eating at least throughout the day, every half an hour to 1 hour we are eating. And gut is continuously working, and it is leading to a lot of problems. So studies have been done that particularly on the night shift work people, those who are working in the night, late night, that the melatonin rhythm gets disrupted. It also gets disrupted by the artificial light, by the electromagnetic waves. And when this gets disrupted, circadian rhythm disruptions occurs, and this lead to the along with the irregular diet, all these leads to the aberrant epigenetic modifications, and hence activation of the abnormal proliferation of the cells, or activation of the abnormal pathways leading to the cancer. Gut health is, as I told, we have very, very important. And because we are eating throughout the day, we are eating outside through Swiggy, Zomato, children are having a lot of gut dysbiosis, and which can later lead to multiple problems, including the cancer. Very, very important topic and very good and nearer to my heart is the effect of the water, sounds, and music. We have forget how to use water as in medicine. We have forget how to use sounds and music in the cure, in the treatment of the diseases. Now a sound wave therapy has been machine has been developed in which the sound energy is being used to kill the cancers. It hasn't come to India. It is still under trials, but it is coming, and there's so much power in the sound. That is why the music has got such a beautiful effect on us. So this Om sound, we have been in India, in being a Sanatan Desh, we have been always asked to recite Om, Om, Om. And see, if you recite Om in a good way, over the time, it has been found in the studies that chanting of the Om can lead to the formation of the Shri Yantra in the body. Shri means, it doesn't mean, what does that mean? It means that our cells get aligned. They become aligned to the power of the sound, and they become much more coherent. They become much more balanced. And when they become coherent, they become balanced. They are happy with each other. They form the Shri Yan. So this has been found, and that is why the significance of the Om mantra is there. So change your vibration, change your life. There's a beautiful video I've got where ancient Buddhists used to move the stones with the help of the sound waves only. So there are a lot of factors involved in the reversal and the prevention: exercises, diet, gut management, removal of the toxins and the waste, resolving the conflicts. Your pranayam plays very, very important. जिंदगी क्या है? सांसों का खेल. तो सांसों को अगर हम अपने कब्जे में कर लें, हम उसको संभाल लें, तो बहुत कुछ जिंदगी में हो सकता है. Then definitely, being a doctor, we need to understand your disease through tests. We get the test done, and once you are suffering, we need to compensate the deficiencies through the supplements. So these are the books which you can take the pick. 10 seconds I am giving. These are very good books, and this Dr. Sarai Stanek has written. She had a multiple sclerosis which she controlled, cured herself with the help of the diet alone, diet and exercises. So all these are this book is written. This book is being written by the doctor. This is also anti-cancer, again by a doctor, Dr. Sarai Stanek. She had worked in. She's from America, and she was the HOD of the communicable diseases. And this is a very big study to show what is the role of diet, lifestyle modifications in our life to prevent the cancer. So I have developed a Kitchen Cure series where I tell everyone to think in color, eat in color, and live in the color. And we are supporting people through our program called Manji, where we support the cancer patients. I conduct workshops so that people are able to understand what is the lifestyle modification. And now something about the functional medicine. So a lot of people ask, "Ki aap functional medicine expert ho, to aap kya karte ho? Ye kya hai?" So the functional medicine is science-based medicine only. It's a personalized medicine for primary prevention and curing you. We I gave you the first slide where we examine the core imbalances. As I told you, once any patient or girl comes with the obesity, immediately my mind starts working. She'll have the excess of estrogen. She is going to develop the gallstone. She is going to develop PCOS. She is going to develop then later. If she has got the PCOS, then the obesity, then she will have the diabetes, hypertension, later stages, some of the cancer common to obesity. So that picture starts running. So immediately the obesity triggers how is her nails, how is her hair, whether she is exercising or not, what she is eating. So it looks at the core imbalances which can lead to the various diseases. And we use the integrative approach in the functional medicine. So we look at the modified epigenetics in cancer, and these are the things which it can cause increased damage, DNA damage. There's a loss of repair. Then there's a hormonal issues. There's alteration in cell cycle and physiology. So what we do in the functional medicine, we promote the general well-being. We we try to promote gene stability, control inflammation, we support the immune system. So a lot of things need to be done. I will give you one example, which we start with first of all, any patient comes, we need to make them happy or feeling of general well-being needs to be given. So what we do, we ask them to do pranayam, improve their water intake in the terms that we ask them to keep the water in copper vessels, diet, nutrition, laughter, emotional outlets, relaxation, sleep, activity, passion, which they really like it, and then exercises, movement, social support, spiritual pursuit, and the areas of the poor organ. How do we do that? We do by the phytonutrients. We try to reduce the blood sugar level so that in which we ask people to have low glycemic, high fiber, no refined carbs, decrease omega-6 intake, increase the omega-3 and omega-9 intake like olive oil. We restrict copper foods in certain patients, and supplements which we give is mitochondrial support, especially L-carnitine, CoQ, alpha-lipoic acid, and definitely the gut we give we try to create the probiotic flora through the diet and through the supplements. So I just wanted to show you that nowadays the children are always playing mobile, or they're seeing the TV, or not doing, or sticking to the computers. In older times, we used to have so many beautiful games, Pachita, Stapu, Korika game hum log khelte the. All these have been now forgotten. So there are a lot of other therapies, ozone, high dose, hyperbaric oxygen therapy, sauna, all these are there. But foremost is that you improve your diet, you take the proper diet, you do the sufficient exercises, and do the meditation. Our ancestors used to work at least 16 to 18. What a youngster of 20 years can do right now, our 80 years old person can do around 20 years or 25 years back. So the best way is to get started, is to quit talking and begin doing. That's what I recommend. Thank you.
A big round of applause to Dr. Sujata Mittal. Thank you so much for sharing such a knowledgeable information with us. Now, I would like to ask, does anyone have questions?
I hope I am in time. Hello?
Yeah.
Okay, thank you.
Does anyone have questions for Dr. Mittal?
Yes, I have a question. So this is Vikram, Dr. Sujata Mittal. Thank you so much for that insightful session. And most of your slides are like, it's like mind blowing, I would say, because even though we are all youngsters, I mean, this session was so helpful to us, because even when there is a smallest gut issue, right? I think it's so important to understand what is going wrong in our day-to-day cycle, because that is the root cause of all the things that I've understood. So my question to you is, Doctor, I am hearing that many of my friends going through this Vipassana, the naturopathy, right? Vipassana.
Vipassana, yes.
So do you recommend that for people like us who's like busy with our work and trying to adjust our schedules with family and all that stuff? So how do you think it's going to help us in a long run?
I think you're answering your question yourself. What problems you are facing, first of all, you need to answer that thing. Hannah? One should not go by what others are doing. As I told earlier in the slides also, you see your life. What problems you are facing? Are you able to adjust to the circumstances? See, one thing very clearly, every one of us has to understand that we cannot change the world. We cannot change the people around, even in our family. We have to change. And if we want to have the change, we need to adopt certain tools. So Vipassana is among one of those. There are so many tools, as I told, Landmark is there, Sadhguru is there, Vipassana is there. So if you feel that you need to change, you are not able to adapt to the circumstances, or if your family is saying you are so and so, or if you're feeling I'm becoming aggressive, or you're having the issues with your life in the terms of digestion, or not exercising, or you're thinking a lot, all these can lead to the diseases. So if you think you're having these things, or you're not able to adjust to any of the family member, to your boss, to your colleagues, then of course, according to me, this is very, very important to adopt these tools. I have changed remarkably to all these things. because without them, I could not manage my life. And one more important thing I would like to tell all of you, I have seen my professor shouting and throwing the instruments in the operation theater. And as a young doctor, when I was doing my post graduation, I felt that shouting is very good. You are the boss when you are shouting and getting aggressive. But over the time, I realized when became 45 that it's my weaknesses which makes me shout at the people. Because if I'm not able to do the surgery properly, then I will shout at the others. I will get impatient because it is my inefficiency. So once you start feeling this, that you are inefficient in some way, and you're getting aggressive and you're not able to manage the sales, we need to adopt certain tools. So Vipassana is also one of those tools.
Thank you so much, Doctor.
Now I'd like to invite the Toastmaster Vrinda.
Yeah, thank you. So, Dr. Sujata, that this was a really invigorating session. I was spellbound listening to you right from the start to the end. A lot of questions came to my mind, but one of the main questions was, when you talk about lifestyle, what I've noticed is I was imagining how do I, share this with family and friends. And most of my friends are people who are extremely busy, working from morning till evening. So they are dependent on outside food. They are dependent on, using the microwave to reheat, because usually they cook in the night, they put it in the fridge, they eat the next day, microwave it. And things like even the simplest thing of reheating food I saw is, can lead to serious disease like this. And I saw you mentioned about how you balanced your journey. So can you share a little bit more about some tips for people to start changing their lifestyle? Like, what are the small things that we could do to begin to lead a healthy life?
Yeah. Thank you for putting that question. Very, very important. As we told, that diet is very important, and 50% raw. And once you go on to 50% raw, the pH starts shifting. So keeping the things raw is very simple. You need to take for example, I didn't had any habit of eating lot of fruits. So we keep, now we are breakfast only, we are taking fruits only. Smoothies if you have got time, you can prepare the smoothies or the fresh juices at home. Otherwise, you have fruits. Then the sprouts, you keep the sprouts and boiled potatoes. You take all these things and use them there in the office. A different type of the fruits you can carry. And I think what we are advocating people, that raw breakfast should be the raw. Then before you take anything, put in your mouth, you take a bowl of vegetable salad in the afternoon and bowl of fruit in the night. And then you eat whatever you want to eat. That is the way. So if you keep your things raw 50% and you take the fruits or vegetables and cut them if you have got some time, or you can slice them at the home. Don't add salt and whatever the other things we are adding to the solid, you put them there, then it will be very easy. Then whatever you are taking, you're giving good amount of raw to the body. And through the raw, because through the raw you get all multiple B complex multivitamins. So you have to understand that the cooked food is dead food. In summers, if we cook the food, we need to keep in the fridge, as you said. If you keep it outside, it will become the stale. What does that mean? That means it has the bacteria has started germinating in it. So that is why we keep it in the fridge. So if you start taking the raw, even if you cut the apple right now and keep it in the open, tomorrow is still, after removing that black portion, you can eat. So focusing on more on the raw, it will be easier to take them to manage your diet and having a healthy body.
Thank you.
Yeah. Are you able to understand the foremost is everything, whatever I am telling you, should be able to understand it clearly.
Yeah, this was very helpful.
Thank you. Thanks.
Yeah.
Sprouts, always sprouts at different types of the sprouts. काला चना है, दाना मेथी है, आपका गेहूं का भी निकल जाते हैं, मूंग का तो निकालते हैं, है ना? पीनट्स हैं, सोक पीनट्स आप हमेशा रख सकते हैं. कोकोनट है, आपके घर में कोकोनट हमेशा आप तैयार रख सकते हैं, फोड़ के रख सकते हैं, which you can take and add to your salads there.
Toastmaster Shahid, you can ask your question.
Yeah, thank
I'm
you.
sorry I spoke in Hindi. I'm sorry.
It's okay.
Yeah, thanks, ma'am. Yeah, maybe most of us understand Hindi, so that's not a problem. Thanks, ma'am. Yeah. Thanks, Sujata ma'am, for that wonderful session and so much informative. So to make us fit as fiddle. And
Yes,
my
it is.
question, yeah, my question is related to the slide which you have shown on the diet. So in the diet, you mentioned adults don't drink milk. So, but from the childhood, whatever we are hearing and practicing, we used to have at least one glass of milk or a cup of milk. So as the days passed away and we have taken that milk. Now I have a small kid of 5 years, so I'm just taking care of her. So what is this milk? Do we need to drink milk or we should not drink milk?
Yeah. See, milk is as such, if you see the Ayurveda, it is a complete whole food. But with the commercialization and industrialization of all the things, milk is not now we are buying the milk. We are initially in Indian old age Indian family, we used to have a cow or buffaloes. We used to have a symbiotic relationship with the milk, with the cows. We used to treat them as a mother. We used to give them different type of the food, fodder. Now we are buying the milk. So what is happening exactly in the dairies, commercial dairies? They are giving the packaged food, but that is one aspect. Cruelty is another aspect. And the foremost from the health point of view, the thing is they are giving them hormonal injections. One is the syntocinon for increasing the amount of the milk, but another is the recombinant growth hormone they are giving. And then every year they are making them pregnant. They are not getting pregnant through the natural ways. Artificial insemination is one thing, which is again a very bad thing because it provokes lot of hatred or some sort of the hormone. Suppose, just imagine putting the hand inside the cow or the buffalo and putting up the semen there. So that process itself is not enjoyable. It creates different types of the hormonal environment inside the body. And I have already discussed with you the interior milieu, impact of the internal environment on the cells. And then they are giving the growth hormone, which so as to increase the amount of the milk. And every year they are making them pregnant through the IVF cycles every year. So initially, if you look at the cow or the buffalo, they used to get pregnant in 2 to 3 years. So the most important problem we are facing is that we are getting little bit amount of hormones every day. And that is why the girls are having PCOS. Obesity is a major problem. We have got lot of cancers, and obesity is not getting controlled. Then diabetes, hypertension, all these are linked to the milk. So if you can keep your cow at home, have a symbiotic relation, nurture her, give her what she requires, green grass, fodder, do whatever she wants to get done. Keep her clean. There in the dairy farms, they give them antibiotics. Every day they are getting antibiotics. Now the machines are present to extract the milk. They are causing small injuries, and the blood is also getting mixed with the blood. So this is why we are this is why we are advocating that we don't require the milk, and we are giving the example that the adults, as an adult, we don't require the milk. It is in this context of today's era that we are not exercising. Previous, if you see my great grandmother, she lived up to 108 years, and she used to tell me, "I'm alive. I'm doing fine because I've eaten a lot of ghee, and I have seen her working till the age of 85, 90. She could squat on the floor, do pocha and whatever she wanted to do. Today we are not working. We have got the cars, we have got every facility at home, washing machines, dishwasher. So if you are using the milk, then the milk absorption in the body is a tedious procedure. We always notice that if we eat parathas and curd or milk, at this age we feel sleepy. So body is about not getting sleep, not sleeping after eating food. It is about doing the activity. The food we take is to become active so that we can do the work. So that is why we are saying that the milk is totally not recommended, especially once you have started suffering from the chronic health condition or cancer, because hormones you are getting day in, day out.
Okay. Yeah. Thank you. Thank you so much, ma'am.
Now, Toastmaster Ishita, you can ask your question.
Yeah, thank you, ma'am, for this very enlightening session. My question is, are there any blood tests that we can do for early detection in case something is going wrong in our body and we can't know? Because sometimes cancer shows up at a very advanced stage and people are totally unaware of how to identify. So can you please guide us in that? Thank you.
Thank you, but I told you that body guides us. See, it is so intelligent body, but God has made the body very, very intelligent. Those who are having arthritis, they would not like to squat. They would not like to sit on the floor. They would not like to climb. So body automatically tells us that what it is having. Only the thing is that we are not paying attention to the body. We are seeing the TV while eating. People are coming to us having acidity. They want the Digen or pantoprazole or Rantic, and then but they're not paying attention to what they're eating. So first of all, the most important is that we should pay attention. Our body wants us. Suppose we have got pain in the joint, it means something is wrong. Something is wrong with the joint, and it is through the diet or the lack of exercise. So having said this, there are definitely tests. There's one costly test called the circulating tumor cells, which can detect the number of the cancer cells in our body. See, all of us are having the cancer cells in our body. The number is limited, 5 to 10. But beyond that, if it is there, then it is this circulating tumor cell test is able to tell us. But this is a very costly test, 1.5 lakh to 2 lakh. So everyone cannot get it done. So the simpler test is, one is the metal toxicity test, because we are absorbing a lot of metals from our water, from air, from our food. So metal testing like your mercury, cadmium, lead. Lead is coming from the wall paints. Mercury is coming from the those who are taking non-veg, or even from the tires, different types of the tires there. This is all the effect of the industrialization. So one is the metal toxicity test, then your CRP, C-reactive protein, that is an inflammatory marker. Then again, homocysteine is an inflammatory marker. So, and your platelet count. Now, where people don't pay attention, there are certain tests, very simple tests. For example, platelet count and reversal of the AG ratio, means total proteins. In total proteins, we have got the albumin and globulin. So albumin ratio is always higher as compared to the globulin. But over the time, we have seen that whenever there's a reversal of AG ratio, means globulin is more and albumin is less, then this is the first indication that patient is going to have certain chronic health conditions. Okay, so I prefer to get D-dimer, CRP, metal toxicity test, then your platelet counts, reversal of the AG ratio. These are the most important. And definitely vitamin B12, D3. These are not the markers of the cancer, but definitely they are lower in every person throughout India, because we are not exposed to the sun the way we should have been to, and we are not exercising. So their general B12 and D3 deficiencies are very common, but they're not markers of the cancer, but they are linked to the cancer. If your body is deficient in the vitamin B and 12, especially vitamin D, you are prone to develop the cancer.
Thank you, ma'am.
Now, DTM Noor, you can ask your question.
Thank you, Toastmaster Adi. Madam Sujata, thank you so much for this wonderful presentation. I believe anyone can give information, but giving information which is useful is tremendously helpful for all of us. I have one question, madam, to you, and one request. The question is, I have experimented with my life. I'm a vegetarian for 45 years. And I have experimented with several foods. Now, what I found most beneficial, and I want to get confirmation from you, is number one, I don't drink milk, and because I was not losing weight, and I feel a lot active after I have given up milk. Number two is this parasite cleansing.
Parasite?
Cleansing.
Parasite cleanser.
Yeah.
Okay.
So
Yeah.
I take wormwood to clean the parasite. From the time I have been doing this, my health has improved dramatically, and walking barefoot also has helped me. Now, I
Yes.
want you to just confirm, just if I am in the right direction. I'm not sure because you're the authority on the subject. So I would just ask for your verification. Does these things really help, or is it just the social fad which is going on? Uh, but it truly, as far as I am concerned, from my experiments, they have helped. But I just need confirmation from you all.
Thank you. Thank you for putting up this question. For the other audience also, he has told that after leaving the milk, he has felt much more energetic. So this is very good. Milk is not bad, but if you keep your cow, as I told earlier, it is, then you can have the milk and milk products, plus you exercise sufficiently. So you are the living example to tell other people that that milk is not required by the body, and we have got the better alternatives like coconut. Plant-based, in plant-based diet, we advise coconut milk, almond milk, soya milk, or this thing, your till. We advise their milk. So one thing is there. Then the root causes. Now the medical science is also saying that all the diseases, they start in the gut. So parasitic cleaning is very, very important here. In my setup also, when I start treating the patient, we give them enemas to clean the gut. We give them castor oil and start with giving the anti-helminthic. So whatever you have done, see, again, I'm focusing and telling that your body will tell you that whether you are fit and fiddle, and a fit as fiddle or not. So when you are doing, you are yourself experiencing the results. There's no need for me or any doctor to verify, because if you are happy, if you are able to get up morning happily without any pains or aches, just a second, please. Just a second. So, and you're able to work. See, those who are obese, if we tell them, please get up and bring a glass of water, they would not like to get up. So, if you are able to work immediately, you are happy with your body. This means it's whatever you're doing, it is working perfectly all right with you. Excuse me, are we still there?
Yes, madam.
Yes.
We are here. Yeah.
Yeah. So, was I audible?
No, no,
Yeah.
you are not audible. I'm sure that I have a kid at home and I know how it is.
No, nothing was audible, whatever I said.
No, ma'am,
No,
we
no,
were able to hear
everything
you.
was audible. Yeah,
Okay.
everything was audible.
Okay, okay, okay. So are you able to understand whatever I
Yes,
said?
madam.
That if you're
Yes.
happy with your body, body will directly tell you that whatever you are experimenting, whatever we are doing, if you are energetic, this means this thing is working for you. Okay?
Yeah. One request, madam. The question is over. The request is now you have shared a tremendous amount of information. For example, the tests, what we need to take, the foods, what we need to do, the best practices. If you could just, if you don't mind, if you could put these things in a document, and you can share it with our president, we all would definitely benefit from this because I have missed a lot of things, the tests, what you have told. I try to note it down, but I'm sure you have a lot of things to share. If you could just put it down in a document and if you could share with us, I would truly appreciate it. We all would actually.
Okay, that I will do. Okay, no problem. No problem.
Yes. Now we have Deep Kaur. You can ask your question.
And thank you, Toastmaster Adi. And thank you so much, ma'am, for an insightful session. I'm so grateful that I joined the today's session. So, ma'am, I have very generic question. Like, as you said, there are three things: exercise, meditation, and the food we are eating. That on that depends how I am or how my body is, right? So, but in today's social media, we have so many reels and so much of information over there. So we started following some, but again, as you said, everybody is different. So you don't know which will suit you and which will not. But still would like to understand from you if there is any book or any other reference that we should start following to guide us better for the diet journey or for our lifestyle journey. So uh, if there is anything that you should refer us to start following, or we should start consulting a dietitian, because for me it's like I started doing exercises. I started doing the food in a proper way, not in that much proper that we are eating, but yes, I started cutting the sugar and other things, and that give me not much but a little bit advantage over there. But still, if there is anything, I still have doubt. Should I go and consult a dietitian so that she will make a chart for me and I will start following that? So, any guidance from you, any reference from you on that one? Thank you, ma'am.
Yes. First of all, I would like to say that the allopathic dietitians are not good. They are not taught about the nutrition. In fact, we are not taught the nutrition at all. Hana? So they are taught about the nutrition the way the allopathic science is. And in allopathic science, they talk about the milk, they talk about the curd, they talk about the veg, non-veg, everything. So if you talk of the allopathic dietitians, they are of no use. They are not good to at all. Definitely, I have already shared the book. Everyone should go. What is missing from the medicine? Dr. Sarai's Stanek book is very important. Anti-cancer book is also very good. And their book by the name of Knives Over, Forks Over Knives. Forks Over Knives. There's a whole, I think, website also, and this book also, Forks Over Knives, giving a inclination, different recipes about the vegetarian diets. There's lot of trials, lot of books. If you search, you will find. But in overall, what I have enumerated to you, that it is a vegetarian diet, and 50% raw should be there, and exercising, which is best suited to our context. If you really want to have the healthy life, is the asanas. You can have the training of the Hatha Yoga asanas, and then meditation in the terms of everything, what you're putting in your mind, how you're controlling your mind, that thing. So the allopathic dietitians are not good at all. Definitely, there are a lot of books. I've mentioned few. You can go through them. And then, see, there's a lot of doctors. I'm not talking of allopathic doctors. They are also doing, but now a lot of courses are there. And international courses are there, functional medicine, also nutritional courses are there. And then finally, the thing is that you have to experiment. If you're having a problem, you have to experiment and see how your body behaves with the different foods. That is the best way to learn the things. I've given you the guidance, go by that. And then those who are doing certain courses or conducting certain courses on the diet, you can always take the courses and learn from them. There are a lot of courses going on. I can guide you later on about those courses, those who are doing it, but not from the allopathic dietitians at all.
So thank you so much, ma'am. Thank you.
Toastmaster Vrinda, you can ask your question.
Yeah, thank you for allowing me to ask one more question, but this is a small one. Ma'am, the follow-up question that I have is again about milk. And you mentioned about how the alternatives for milk. I also heard that yogurt, like, if you don't have milk, but having the regular yogurt is okay. Just wanted to ask, is that really true, or we should give up like completely dairy?
No, if you're, see, it is better to avoid modern dairy totally. No yogurt, no buttermilk, no cheese, nothing. We have got good alternatives. You can prepare the curd from the coconut milk also, almond milk also, till with the till and your groundnuts. Okay. So, well, and especially once you're having the problem, chronic health conditions, once you're having that, then you have to totally quit the dairy, modern dairy, totally quit it.
Okay. Thank you.
Yeah.
And I hope the executive committee invites ma'am again and again because there's lots to learn from you. So we hope that we see you again. Thank you.
Yeah. Thank you. Thank you.
Toastmaster Amar, you can ask your question.
Thank you, Adi. Thank you very much, ma'am. It's a great insight, and I really understand what you are telling. But one question I have on you have mentioned the causes of the cancer, what you put it in your plate, as well as what you put it in your brain. So I understand what you put it in your plate, but when it comes to what you put it in your brain, so that is majorly on the external consequences that we cannot control. So what kind of cancers it may cause because of your thought process?
Yeah. So it's not like that. The particular thought will cause particular cancers. I will give you one example that how the emotions can play. We have got a lot of doctors and we are seeing day in, day out nowadays, females coming with the breast cancer from starting from the age of 31 to 45. Breast cancer we used to get women from beyond the age of 45 or 50, earlier around 15 years back. And what I have noted, especially in my doctors community, that the separation or the divorce or the death of the spouse has led to tremendous impact. I know personally 4 doctors, those who have divorced their husband and immediately they have suffered the cancer within 2-3 years. So as I told in my slides, it's not that the external circumstances, but how we are controlling our brain, continuously thinking about the particular thing. And breast is considered to be emotional organ. Okay, I will not go into the details because of the everyone is present, but it is fondling and all those things are there, and it is a emotional considered to be emotional organ. So after separation, female women are suffering, had suffered from the cancer, and we are getting day in day out lot of girls. They are not able to adjust to the whatever the circumstances are. We all are very aware. So this is the one type of the example I am giving you. Similarly, multiple myeloma. Prisoners, those who are in the prison, they are developed deep core inhibitions. Deep core inhibitions are because they are in the prison where the sunlight is there, less, sunlight is very less. So these deep core emotions which are suppressed, they can lead to the multiple myeloma. Similarly, those who are not able to speak in the terms they are not able to express in the family. It has been found that they develop a throat or thyroid cancer, throat cancer, like that. Of course, the throat cancer is linked to chewing the tobacco, gutka, and smoking also. But why particular person develop the habit of eating gutka, chewing tobacco, and all those things? That also needs to be considered. Why they got addicted to all these things? Peer pressure or family circumstances. So all these things. I have given you the example. This is the way the cancer affects. It's not that particular thought will affect in a particular way and cause that particular cancer. But definitely the thoughts are directly, your stress is directly linked to the cancer.
Thank you, ma'am. Thank you.
Thank you so much, ma'am, for all the information and for kindly answering all our questions. Thank you so much. Now I invite President of our club, Toastmaster Ishita Patnaik, to present Dr. Sujata Mittal with Certificate of Appreciation.
Thank you so much, ma'am. It was a wonderful session and you have patiently answered all our questions as well, ma'am. So I have no words to tell you about how much you took out your time to come here and give us a presentation. We are really grateful to you. Thank you so much, ma'am. We'll invite you again, definitely. Please accept the certificate of appreciation and recognition from us. And we would love to have you again in our club. we would also like to have a group picture with you, all of us together.
Okay.
So let me make the arrangement for that.
Definitely. Will you send the certificate to my mail?
Yes, ma'am. We will send you. So I'd request all of you to please turn on your camera and show a heart symbol as a sign of respect to ma'am. Yeah. All of you ready? Cheese? Yes, all done.
So let's all of us be fit as fiddle. Okay. I have
Yes,
also.
ma'am. You used the word of the day multiple times. So you are getting the Toastmaster vibe as well. You are liking it.
Yes, definitely.
Yes, ma'am. Yeah. So we'll now continue our session as usual. You're free to stay with us, or you can drop off as you wish. Thank you so much, ma'am. Okay, over to you, Adi.
Yes. Now that we're done with a very wonderful keynote speech, I hope every one of you had a great time, great knowledge. And let's dive into our regular meetings. For that, let me quickly start the prepared speeches so that we can save more time. Now, before inviting speaker one, I would like to invite evaluator one, Toastmaster DTM Noor Mohammed, to give out the speech objectives of Toastmaster Amarnath.
Thank you, Toastmaster Adi. Toastmaster Amar is embarking on the presentation mastery path, level 1, project 2, writing the speech with purpose. Now, the purpose of this project is to learn or review basic methods for writing a speech with a defined purpose and to present a well-organized speech on any topic of his choice. Now, Toastmaster Amar's speech purpose statement is to help the audience recognize the psychological influences that drive their spending habits and to provide practical strategies for making more mindful, more purposeful financial decisions. The title of his speech is Behavioral Spending. Behavioral Spending, Toastmaster Amar. Timer, please note the timing is 5 to 7 minutes. Back to you, Toastmaster Adi.
Thank you, DTM Noor, for the reading out the speech objective. Now I'd like to invite Toastmaster Amarnath for the speech. And I'd like to question whether you're able to see a timer.
Timer is not there. I can be the timer for this speech. You can reach out to timer, Adi.
Yes, I'll reach out to him. Can you please raise your hand, Toastmaster Ishita, so that it is visible to Toastmaster Amar?
Right.
Yeah.
Are you able to see me, Toastmaster?
Yes, Ishita, I'm able to see.
Yeah, and let me just show my cards 1 minute. You're able to see the cards, right?
Yeah. Ishita, could you please make Toastmaster Shahid as the co-host? He can do the Zoom moderation until Amar is giving the speech.
Yeah, sure. Just a minute. Got it.
Shall we start, Toastmaster Ishita?
One minute. Sorry. Yeah, I'm ready.
Yes. All the best, Toastmaster Amar.
Thank you very much, Toastmaster Adi. There are two topics that impact everyone, whether you are interested in them or not. That is health and money. I try to blend these two topics in today's page, and I try to put it best with my insights. Let me pose a question. Can money buy happiness? Can anyone unmute yourself and answer, can money buy happiness?
Yes.
Yes, sometimes.
I'll say
All
always.
right. So there are There is no black and white answer for this. So if you consider those who have enough money resources, financial resources, they might not see money can buy happiness. They might struggling to manage their happiness and they couldn't able to make happy because of money. Let me put it in another way around. Can you be happy without money? It brings a lot of fear and anxiety, doesn't it? Good morning, my dear fellow Toastmasters and welcome guests. So today I'm going to talk about behavioral spending, which refers to how people make financial decisions based on the physical, psychological emotions and other factors rather than purely logical reasoning. For example, people might overspend when they are in stress or depressed and also indulge in impulse purchases to reward themselves. When it comes to me, it was happened. I've been going through a financial crisis since my father was deceased suddenly due to COVID. I invigorated by taking deep breath and digest the fact that we are broken financially. And at that time, I took a decision to purchase a car, which is of high budget, because I just want to reward myself and I just want to show to the world we are not broken. We still have the courage to come up from this crisis. So most of us are suffering due to the lack of enough financial resources or peer pressure. So today I'm going to talk about the lack of financial resources. I have a relationship with money as a mix of insecurity and childish stupidity. So nobody teaches us in the school about the money. So we learn money through our learning experiences or from our family spending behaviors. Similarly with our health as well, we need to learn and understand our body. And according to that, we need to make the good habits. So if you take a 1 degree of inclination, either it is towards the bad or good. So you will, over the time, you will end up at a good result if you start with a good habit. So similarly with the other side of the coin as well. So your personal experience with money or health, it is 0.0001% of happening with the makeup with the other people around the world. So I have seen two different spending patterns in my journey with my father and on the other side with my in-laws family. My father was a politician, so he always spent time with people, and also he has taken a responsibility to take care of his 9 other siblings at very early age. So spending becomes his an habit for him. Through this, so he become lavishly spend his money to the people around him. So though he didn't have any dedicated channel of income. On the other side, my father-in-law is a retired teacher. He got his first job at his very late in his career at 33 at his age, he got the job. He's so very frugal in spending money to maintain his family of 3 girl childs. My father was always spend time people around with me and listening to the people's problems. He tried to help people around him whenever they're in need. As in when we grow in life, we need more money to support our financial needs. So in my village, most of the people, they treated like asking or seek help from my father was a birthright. And later, even he don't have enough financial resources, he tried to help people borrowing from money from other people. So my mother and father used always have a quarrel for the same reason. And my father used to tell how we can get plants without seedling. Maybe his point of view is if we help people in need, it may come as a deed virtue for our descendants. So on the other side, my in-law was maintaining a very low profile with respect to finance. So he is able to manage his finance with his limited resources in his life. And end of the day, my father was broke financially with at least ₹500 crore. And my father-in-law, by his retired time, all his 3 daughters are postgraduate, and one is a assistant professor in Pennsylvania University, and other is serving as a teacher in the school. So what I mean to say, we need to spend our time and money wisely. I just want to conclude my speech with 2 things. If you really want to become a rich, you should look like a poor. So your habits should be poor. Then only you can become rich. And we always postpone our decisions and homeworks in life and work in workplace, right? Similarly, you need to postpone your thought of spending money. So if you want to buy a new car, just postpone that thought. If you want to change your mobile, just postpone that thought. With this, I'm concluding, and it over to you, Toastmaster.
Thank you, Toastmaster Amar, for such an insightful speech. Now that we're done with speech 1, let me invite evaluator 2, Toastmaster Vrunda, to read out the speech objective of speaker Shraddha.
Thank you, Toastmaster Adi. Fellow Toastmasters and guests, it gives me great pleasure to introduce today's speaker number 2, Toastmaster Shraddha Tirthali, who is presenting her Level 1 Project 2 speech from the Persuasive Influence Pathway. This project focuses on writing a speech with purpose, where the speaker is challenged to deliver a well-organized speech with a clear message and intent. The title of Shraddha's speech is Other Side of the Battle. This actually gives me some hint that this is going to be an interesting speech, and we are going to hear some powerful perspectives from Toastmaster Shraddha. With that said, let's all join in welcoming Toastmaster Shraddha for her speech, The Other Side of the Battle. The Other Side of the Battle. Toastmaster Shraddha, over to you. All the best.
Thank you so much, Toastmaster Vrinda and Toastmaster Ishita and everybody in this club for giving me this opportunity. So the title, as Toastmaster Vrinda said, is The Other Side of the Battle. So there is a famous quote that we've heard. You never know how strong you are until being strong is the only choice that you're left with. Good afternoon, everyone. First of all, thank you, Ishita, Toastmaster Ishita, to having me here. And I was really impressed by the agenda for this meeting, Dr. Mittal's speech. I realized that I'm, running a lot in the competition. I have a lot of toxins I need to detoxify. However, today I'm not here as a professional. I'm not a doctor at all. I'm an IT engineer. I am not a specialist from that perspective, but I'm merely here as a daughter and a sister, for women who have actually made me see the true value of strength, resilience, and courage and love. So cut one, basically, a few years ago, pre-COVID era, I remember me, my sisters, and mother sitting in a room. It was a visiting room of Dr. Ranade. It was very cold. The AC was blaring directly at our face. We were waiting for him, and there opened the door. A short, stout man with a salt and pepper look in his late 50s entered. He had a file in his hand, and he sat down. After a moment, he broke that particular news to us, and it was a C word. So my mother was diagnosed with cancer. And as soon as he said this, for a moment, all of us couldn't say anything. We were dumbstruck. We didn't know how to react, what to say. However, he took it further. He said, okay, now this is what we need to do. This is the course of treatment, and this is what I suggest. Like any other Indian patient, we went to another doctor for second opinion, the third opinion, and the fourth opinion. However, most of the people, all the doctors said very similar thing, that you need to go through a chemotherapy and a radiotherapy. So then the search for right doctor, right institute or hospital started. So I belong to Pune, and Ruby Hospital has the best of machinery, is what we were told, for radiotherapy, and really amazing doctors. And we also chose Jahangir for chemotherapy. They are just in front of each other. The doctors are common across both. They are all aligned. So that was what we started with. However, one glitch that we had is when we went to the admin office to start with the process, we were told there is package 1, package 2, package 3, and we were for a moment, it was difficult to digest that we are getting into a situation of somebody having a cancer, our mom, our dear mom, and we are talking about packages and certain lakhs of rupees for each of the packages. However, that was where we were, and we wanted best for our mom. So we actually tried to get through these hurdles of administrative things. We chose the right best package for her and went ahead with the treatment. Cut to, I remember in Jahangir, we were in that room of chemotherapy. It was day boarding for her initially. And the room was filled with medicines, the smell of medicines, the nurses in crisp uniforms walking around, other patients, their families. However, there still was some kind of hope in the air. So we used to carry a lot of snacks, which she could eat, and of course us as well. We could carry, playing cards, board games, books, to make whatever time that we had together more enjoyable, pleasurable as much as we can. However, with all that as well, slowly the treatment started showing its things, and she started having a lot of side effects, and she became very, very irritable. Another aspect was my mother, who was in her early 70s. She was a caregiver for my father. My father was having Parkinson's for 15 years. She was sole caregiver for him. And while she was having her own, battle, she was constantly worrying about my father, who was back at home, whether he has eaten, whether he has right people around, because he couldn't function much alone, and whether he's had his medicines, etc. However, I think all of that agony also, helped her in a way to showcase the strength and fight with whatever she was going through. Whatever she showed as a caregiver, I think that particular thing has been inherited by one of my sisters, Devyani. And while we were there always in the treatment together, all our siblings, she was there after the treatment as well, because the treatment, post-treatment, whatever time that we have, that is also very, very critical. The patient is very, very fragile. While she had won the battle and she was almost fit as a fiddle, she still needed some care. So my sister was always there making soups for her, making her own recipes to ensure that she has a nutritious diet. She was taking all the rank from her as well as all our relatives. Typically, a patient is not supposed to visit a lot of people after these treatments because their immunity is very low and they can catch any infections very soon. However, it was not taken too well by some of our relatives and friends. So it took a quite negative turn in some cases when people were pushed back or they were not welcome. However, my sister continued to showcase her resilience through this entire process. And eventually now our mother is back in best of her health. With all of this, what I wanted to showcase or share is, yes, we are right now discussing, we saw a lot of things that Dr. Sujata shared. We are thinking about how we can prevent the cancer. We actually hear a lot of stories around the people who have really won this battle. but there are people who are behind them. These are the unsung heroes. These are the caregivers who are always there with the patient. Sometimes the patient wins the battle. Sometimes, unfortunately, they lose. However, there are always people who are behind them, who are always constantly supporting them. So let's take a moment to appreciate them. Let's take a moment to say that, yes, we know you don't feel sometimes adequate, sometimes you feel guilty, but whatever you're doing is amazing. All those warm words, the warm hug could definitely invigorate them. So humble request, please, whenever you meet with somebody like that, definitely, give that warm hug to say, we really know what you're going through and we appreciate you. Thank you, everybody.
Kudos to for all the strong women, for you and your sister and your mother for fighting the battle and winning it. Kudos. Now I request Toastmaster Ishita to launch the best speaker poll.
Poll is launched. Request everyone to please vote. Okay, I have only 6 votes so far. Anyone else wanting to vote? Okay, ending the poll now. Over to you, Toastmaster Adi.
Yes. Now I would like to request Toastmaster Ishita so that we can start a fun session of table topics. Over to you, Toastmaster Ishita.
Thank you so much. I see Toastmaster Bharadwaj is back. You can do the timing for this session. So welcome once again. I know we have exceeded the timing of our keynote session and we have very less time left before our session ends. So we'll have a very short table topic. So I want all of you to please raise your hand if you want to participate in the table topic session. Okay, let me first tell you what table topics is about. It's about impromptu speaking. I am the table topics master and I will tell a topic. And today we are adding a spin to the table topics and we are not going to give you a topic. We are going to show you a meme. And you are going to speak on the meme for 1 to 2 minutes. You will see the green card at 1 minute. At 1 minute 30 seconds, you will see the yellow card. And at 2 minutes, you will see the red card. You have 30 seconds to wrap up your speech. You will get disqualified if you speak more than 2 minutes, 30 seconds or less than 1 minute. This is a very interesting opportunity for you to showcase your quick thinking and impromptu speaking. So who here wants to go for it? Please raise your hand. So we have Toastmaster Bharadwaj raising his hand. So Amarnath, can you be the timer for this session? Okay. All right.
I think I don't have the timer cards loaded.
Oh, you don't have?
I will do the timer.
Adi has the card. Okay, so she will do for Toastmaster Bharadwaj. Toastmaster Bharadwaj, please choose. Okay, I'll spotlight you first. And yeah, please choose a number from 1 to 10. 4. Okay. I'm going to share my screen and show you the meme. I'm sorry, just a minute. Yeah, are you able to see the screen?
Yes.
Uh,
Yes. You can double
Okay.
click on this.
Right. 1 minute. Are you able to see the meme now? Are you able to see the meme now? Or am I focusing on the wrong
No,
window?
yes, it's working.
It's working? Okay. Toastmaster Bharadwaj. This is your meme. Me at a party. No, I don't know how to dance, but me
No,
alone
actually,
at home.
I'm unable to.
Sorry, you're not able to see the screen?
One, I did not. I was unable to see that. Can you post it in the chat?
I'll share again.
Ishita, there is some network issue. It seems he could not see even if you share also. Maybe you
Okay,
can
so
just tell him what it is.
okay, so Bharadwaj, I'll tell you the topic. When someone tells you to dance in a party, you say, no, I don't want to dance. But you alone at home are the master of dancing. That is the meme. Are you able to follow it?
Yes.
I think his network is a
Good
bit low.
afternoon. I think it is clear.
Yeah,
Is it
go
not
ahead.
clear now?
Yeah, please go ahead. Yeah.
Good afternoon, fellow Toastmasters. Good afternoon, fellow Toastmasters. I think it is around 1998 or 91, just when I was a 12 years old kid. So I got an opportunity in my school to be a part of a dance group. So we have done a lot of rehearsals, we have done a lot of pre-work activities, and we have enthusiastically ready to give our best in the annual day celebrations of my school. I don't know what happened. The day has arrived. On that day, I could not perform well on the stage. I was part of the group. The other people are dancing, but my legs are shivering. I was there in the front row, but I could not give my best. That day somehow I managed. The same night, when I came back to home, I went to fresh up. Then suddenly the same song was playing in my TV. At that time in 19, I was a 90s kid. We used to have only one small TV in my home. So that same song was playing in the TV. I literally started dancing in the washroom. And obviously, I fell. That day, I realized that the place is most important to perform. If you are unable to perform on the stage you are given, ultimately the wrong things will happen in our life. And we have to grab each and every opportunity and take it further to make better ourselves in our lives. Thank you.
Thank you, Toastmaster Bharadwaj. Yes, it was a very interesting story about dancing in the bathroom. We all have done that, I think. So, next person, anyone interested in taking up? Okay, we have Toastmaster Shraddha. Can you choose a number?
Maybe 1.
1. All right. I'll share my screen. Are you able to see the meme?
Yes, Toastmaster Ishita.
Okay. So your reaction on this meme. And your time starts now. Are you ready?
Yeah. Thank you for a very interesting one. Yeah, cool. So I have been a good student, above average since school, and later on when I did MBA and recently the certifications. However, there was a time in my career, engineering, when like many other people and due to peer pressure, we were mostly at the boat club. I was in College of Engineering, Pune, and boat club was a period or time wherein we always used to be there, never attended any of the lectures and never knew what the names of the subjects were, what the syllabus was. And just 1 month ahead of time, we would go to a particular lane wherein we get all the books, buy books, and then appear for the exam with just some of the last year's question and answers, etc. And the battle was always trying to calculate, okay, 4 plus 4 plus 6 and this, whether we are reaching that 35 and 40. So entered with, having least possible topics and chapters read, and coming back with that, okay, now today I've reached 45, today I've reached 40, I will pass this exam, kind of a feeling. The last semester was the worst because the previous semester I got placed, and then the entire stress kept in because we had to ensure that we get the first class and had to study eventually. So last 2 months I did study eventually. Every day I wore a same dress because I thought this is my lucky dress, and this light green color is going to give me that first class, which I definitely need to keep this job running. I had a lot of stress, acidity. So it was almost like we saw her in that picture earlier, Ishita, that you shared. So last day it was just that, okay, fine, engineering is done with all the, hair really around, not in the best of possible way. So that's my experience. Going to the examination hall and coming out with all that frustration and experiences. So thank you.
Thank you, Shraddha, for your interesting story. Yes, we all have had nightmares when we have to give exams. Next one. Anyone interested? Come on, don't be scared. Let's try our guests. Anu Gupta, would you like to try one?
Yes, thank you.
Okay, so choose a number.
8.
Which one?
8.
8.
Yeah.
Okay. I'm going to share my screen now. What are you going to get? Let's see.
Yeah.
Okay, are you able to see the meme?
Yes.
Yes. Would you like to come on camera?
Just a moment.
All right. Are you ready? All right. Go ahead.
Thank you, Table Topic Master. Definitely, how many of you believe that making friends are the lifeline for one's life? So do I. I also believe that friends are one of the best medicine to our soul. Whenever we feel like we are depressed, or whenever we feel that we need some good time or want to spend a few things with them, we need to have friends in our life. It need not be necessary that every day you need to have a connect with them. A good friend, at least like one or two friend who you can have trust on them and try to share everything. Definitely that would add value to your life. And even if you see, right, in my life, I have Facebook and Insta. There are many people in the network, but how genuinely I don't get connected with many of them. I can just connect with one or two in my life. So it's like a 2 a.m. friend. Anytime if I can just give a call and say that, okay, this is what is going on in my life, that gives a sense of some advice or something to live about or think about any when you're in a dilemma or something. So I'm blessed with having two of my friends, which are like lifeline for me whenever I don't have any way. That they show me the direction of what to take up a call, how to take up a call and all. So I think even my mom or even my father, even my sister, everyone has their own set of friends. So I do believe that the age is not a constraint for any friendship, and every age has their own friends, because the mindset is always like, if we want to live mindfully, definitely that friendship is friends we have to make and get connected with it. So I do remember like roses are green, but violets are blue, all these things. When in the childhood we are tend to brought up in that way, and that's it. I think we need to have the friendship forever. Yeah, thank you. Over to you.
Thank you. Are you Toastmaster?
Yes.
Okay, thank you, Toastmaster Anu. Yeah, I just saw TTM Noor's comment, and that's hilarious. So thank you so much. Who wants to go next? And wants to go next? Anyone? We'll have the.
I will take up.
Okay. Is that Amarnath, you said?
Shahid, Toastmaster Shahid.
Shahid. Okay, Shahid.
Yes.
All right.
Yes,
Shahid,
number
choose
2.
number 2, right? And I'm going to share my screen now. Are you able to see the meme?
Not yet. Yeah, now I can see. India is a country where people measure distance by time. मेरा घर यहाँ से 10 मिनट के दूरी पर है.
Yeah.
Okay.
Are you ready? All right.
I'm audible and visible. There is some
Yes.
network glitch at my end.
Yeah, we can see you and hear. Go ahead.
Yeah, thank you, Toastmaster Ishita, table topic master, Toastmaster Ishita, for that topic. And by the time I've just seen that meme, one instance came to my mind is like, I was at a bus stop. I was waiting for the bus, and the bus came, and I was about to go to some other place from my native. Then I asked the conductor how much time it will take. He said 15 minutes. But 15 minutes. Then I just sat, and the bus got started. But I was just looking at my watch. It is 10 minutes, and I thought in 5 minutes I'm going to reach my destination. But it is it's crossed 5 minutes, and it costs 5 more extra, 20 minutes, and it is 30 minutes now. But still we are traveling only. But I did not reach my destination. I just remember, I just call that other person who is waiting there. I will be coming in the 15 minutes, and he's keep on calling me. Where are you? Did you boarded the right bus, or you have taken any other bus, or you are in the same direction, or you are going in other direction? Then I'm just explaining him which village is coming next, which is coming. Then he realized, but it is in the same direction, but the time is taking more. Though this way, so I just experienced the thing, like whatever the people said, don't believe, like there are so many circumstances which involves to reach to our destination. So that's my experience on this topic. So with this I will conclude my table topic. Thank you. Back to you, table topic master.
Thank you, Toastmaster Shahid. Yes, India is a place of many unique things, and Indian Standard Time is one of the world's special things about India. And we'll have the last table topic now. Anyone else interested? Okay, the last table topics is to be given to Toastmaster Sarika. Can you come on video? Is it possible?
Sorry, a bit network glitch. Don't mind.
Okay, sure. So choose a number.
10.
10. Okay.
Yeah.
I'm going to share my screen now. Are you able to see the screen?
Yes, yes. That
Okay.
moment when you think it's Friday, but it's really Wednesday.
Correct.
Yeah.
All right.
Okay.
All right.
Fine.
You're done.
Greetings, fellow Toastmasters and dear guests. I'm Toastmaster Sarika from Kite Toastmasters Club. I want to share a few things of my college, which is you might be wondered after hearing this because in our college there is no holiday for Sunday. It's holiday for Wednesday. I think you might got wondered because of it's lazy Sunday for you people, but it's lazy Wednesday for me. You might hear that Wednesday a bucket of KFCs, right? That KFC offer got us a very big lazy Wednesday to us. Everyone said that Sunday is fun day, but for me, Wednesday is fun day. And coming to Friday, the most wonderful day because of entire week I am waiting for Friday. Just because of not the end of the week, because of we have Toastmasters meeting on Friday. For our club, every Friday we will conduct Toastmasters meeting. When it is Wednesday, of course I'm wondered just like that chimpanzee. I'm looking like sometimes I thought like I'm looking like chimpanzee, and I wondered just like that one because of our college give a holiday on that Wednesday. And thanks to my college and thanks to this Toastmaster Ishita for creating that meme is especially suits for me because of our college. Our Wednesdays are beautiful Wednesdays, our Fridays are wonderful Fridays, and I'm waiting for both Fridays and Wednesdays a part of Sunday because of Sunday is not our days. Sunday is not lazy day for me. Wednesday is lazy for me. And thank you, what to you, Toastmaster Ishita.
Thank you so much, Toastmaster Sarika, for your beautiful story. And every day is a beautiful day. That's a very good message to all of us. With this, we will end our table topic section. I'd like to ask a timer, are there any disqualification due to time?
No, ma'am. No, ma'am. All are qualified.
Okay, great. Now I'll launch the poll for the best table topics. Please take a time, take a minute and is the poll visible? Great.
Yes, yes, it is.
Wonderful. I'm ending the poll now. All right, over to you, Toastmaster Adi.
Thank you, Toastmaster Ishita, for bringing out the energy and for making our time worthwhile. Now, I request Toastmaster Shahid to come on to the dais so that we can have the evaluation.
Thank you, Toastmaster of the day, Toastmaster Adi. So I will quickly, instead of spending more time, I will quickly call upon our evaluators. Feedback is the breakfast for the champion. So now I would like to call upon Toastmaster Noor to give her evaluation for the first speaker, Toastmaster Amarnath. Back to you, Toastmaster Noor.
Hello, can you hear me?
Yes, Noor.
Oh my God. One second.
Here and you can see Amresh Puri also.
Yeah, Mogambo giving the feedback. To Amarnath, yes.
No, Mogambo.
Thank you, Toastmaster Shahid. Fellow Toastmasters, dear guests, a very good afternoon to you all. Now, Toastmaster Amma, what a fantastic topic today. Money my favorite subject to study. Now, your topic got me enticed, excited, and engaged. And your introduction started with a bang. I loved it, really. Two topics which impacts everyone is health and money. What a great way to start. And you topped it with that rhetorical questions, which got me thinking, can money buy happiness? And you asked the contrast question. Can you be happy without money? Fear and anxiety runs rampant. Now, this is a recipe for audience engagement, and you did it fantastically. Well done, Toastmaster. Now, what I like about engaging speeches is all of them have context. Now, you set the context for your speech about why people overspend. Psychological factors, which include stress, depression, peer pressure, rewarding oneself with to compensate. Now, that laid groundwork for your personal story. All great speakers, they have personal stories. Now, I must commend you on how you used contrast between probably the two most influential people in your life, your father and your father in law, to show how our beliefs, like for example, when you feel responsible for others without empowering them, a belief that do good to get good, people pleasing, all of it, how it affects how we spend money. Now, I must point it out that you built your two main characters clearly, and they were very strong. You gave backgrounds for both of them, their beliefs, the outcomes of their habits. It became clear to me that you are a thoughtful person with keen observational skills and an analytical mind. Now, there are a couple of things, Toastmaster Amar, which you might want to consider to make your future speeches more impactful. Number one, the rate of your speech can be improved with practice. It is a bit slow at the moment. There is nothing wrong with it as such. Practice gives you the time to focus on other aspects of your speech. Now, that brings me to the second recommendation. I was wondering what precise recommendations and suggestions would you give to get a grip on controlling the money flow? Some key no brainer insights which practically could be implemented by most of us. Now, you are running short on time. Now, I would recommend that if you time yourself a couple of times, which would help you to call spade a spade and trim your speech for maximum impact. Overall, Toastmaster Amar, you are a thoughtful, observant, keen, and a brave man who accepts his flaws and is eager to grow. Please time yourself and practice a little bit more, and you would have more following than that of your father. I wish you only the best. Back to you, G.
Thank you, Toastmaster Noor. Thanks for your wonderful evaluation. So as the context is come, so when the Toastmaster Amarnath was giving his speech and when he asked, is money is important or life other thing is important, then I just remembered one short story. I'll not take much time. So that story is like whether money is, how the money is related with the life. So life is like a boat and the water is money. To sail your life smoothly, the boat should sail in the water, right? So in the similar fashion, you should have the money. But once the money, if a boat got a hole and the water started coming into the boat, then it will sink, right? So in the similar fashion, so we should have a balance in the life and the money. So that's the one short story came into my mind when Amar was delivering his speech related to the financial things. And thank you, Noor. Thanks for your evaluation. And for the second evaluation, I would like to call upon our Toastmaster Vrunda to give her evaluation for Toastmaster Shraddha's speech.
Thank you, Toastmaster Shahid. My fellow Toastmasters, and most importantly, Toastmaster Shraddha. Today, we all heard a very deep from heart speech that came with a purpose driven message, other side of the battle. This speech showed us some light on the journey of those fighting cancer, but not just those people who are fighting the cancer, but also the silent warriors who have been battling cancer along with the patient. Those are the caregivers. Toastmaster Shraddha, your speech was very relatable just because you spoke from your personal story. And it immediately made me connect us because we all hear about cancer around us and we all want to be empathetic, but we do not know how best we can serve those people. And you exactly chose a theme that connected and resonated with us. A few things that stood out for me in your speech: vivid descriptive language. Your description was immensely powerful when you described the doctor, when you described the hospital room in Jahangir, when you described about the whole scenario. I felt as if I was sitting there along with you and I was traveling with you. So you have very powerful descriptive language that you used. The second standout thing, standout was the clear message and the emotional depth with which you spoke. Your pacing, your style of the body language, your conviction all spoke for themselves. So you kind of had an authority about what you were speaking because you had experienced all these things. And your delivery was powerful. It was patient, calm, but powerful. Few things that I would offer for your consideration so that you could elevate your speech to the next level. One, offer a call to action. Since you want to spread the message about how we could empathize and salute those caregivers, what would help us as an audience is to find a call to action, how we could help patients and families. Could it be volunteering, donation, simply spending more time, or how is it that best we could serve those people, the families and the caregivers? The second thing for you to consider is expand on the triumph. Your story was mostly about the struggle and it touched upon the triumph, which we were very delighted to see how your mother survived through all this. But if you could expand more on the triumph, it would motivate the other people who are going through this journey and they will see a light at the end of the tunnel. I also appreciated that you used the word of the day and the idiom of the day. In conclusion, your speech was very powerful. If you could use solid call to action and you could expand on the triumph, it would help more people. So keep shining and keep spreading the word. All the best.
Thank you so much, Toastmaster Vrinda.
Thank you, Toastmaster Unda, for your valuable evaluation. And now we will go to the tag team report. So I would like to quickly call upon our double role player, Toastmaster Vikram Prakash, grammarian and R counter, to present his report. Over to you, Toastmaster Vikram.
Thank you, General Evaluator. Let me present my screen. All right. I hope my screen is visible, right?
Yes.
Okay. Yeah. So today's meeting, I'm very happy that many of you use the word of the day and the idiom of the day. So here I have noted down the instances that each one have used the word and the idiom of the day. So the presiding officer Ishita used the word and the idiom of the day, and General Evaluator Shahid used it both word and the idiom of the day as well. Toastmaster Manoj used both idiom of the day and the word of the day in the same sentence, which was amazing. And the team mod Adi, she used the word of the day, and she also used one phrase in her while she was communicating, that fighting the battle. That was one of the good usage I noted. And then the keynote speaker, Sujata Mittal, had a very good presentation, and there I found a lot of good usages. And apart from that, she also used the idiom of the day thrice and the word of the day once, which is noticeable. And few things, good usages from her presentation, I noted down, like gut is the second brain of human body, garbage in parasympathetic system, samskaras, contemplation, satsang, glory of the sun, visualize the sun, horizon, cooked food is dead food, focus on raw food, artificial insemination, and symbiotic relationship. So all these are some of the good usages which I grabbed from her speech, from her keynote speech. And then coming to evaluator Vrinda, while she was inviting the speaker, she used the word powerful perspectives. The speaker is here to present her powerful perspectives, which attracted my attention. And then I also heard during her evaluation that she mentioned these words like purposeful, purpose-driven message, silent warriors, empathetic, conviction, and elevate. So these are all the words which are very good, and we can use these words in our speeches going forward as well. And coming to our Sergeant at Arms and Speaker one, who's Amarnath, he had used the word of the day once, and then I also found a few good usages in his speech. Like, no one teaches us how to manage money. That is a good point that he had mentioned. And then lavish, spend our time wisely, new and healthy money habits make us rich, postpone your expenditures. So these are all some of the words which I found interesting. Coming to our speaker two, who is Shraddha Tritali, she used the idiom of the day once, and then she also used some of the nice words like dumbstruck, best of machinery, nurses in uniforms, agony, fragile, best of her health, unsung heroes, win and lose the battle. So these are all the words which are very much interesting, and it attracted my attention as well. Coming to our table topics, several people had taken up the topics, and now I can see Sarika used once the word of the day, and evaluator Noor had many good usages, like laid the groundwork for personal stories, and then no brainer and observant. So these are all the words which I was feeling interested, and I wanted to use it in future speeches of mine as well. And as an R counter, I found a few crutch words. These are the words which make when it is used once, it is good. It helps us to fill the silence, but when it is used excessively, then it demotivates the audience, or it distracts the clarity of the message that we are trying to deliver. So it's good if we can avoid these words in our communication. So the first thing is the R. So I found few people used the R's, and then I think you can see the report here. And Toastmaster Vrinda and Toastmaster Manoj speech was flawless. I could see no crutch words and very few, very good usages of the grammar as well. So this is my overall report. I hope it helps all of you, and over to you, General Evaluator.
Thank you, Toastmaster Vikram, for your detailed report for both the roles. And now I would like to call upon our timer, Toastmaster Bharadwaj, to present his report.
Sorry. Let me share my screen. So, as a timer, I have taken the times taken by all the speakers. Our keynote speaker, Sujata Mittal, madam, has taken 32 minutes, 58 seconds, and it is keynote. There is 5 minutes of waste time, so she is not disqualified. So, as a prepared speaker, it is 5 to 7 minutes, and all the speakers are in the time of 30 seconds. Coming to table topics, it is 2 minutes, 30 seconds in the cutoff time, and all the table topic speakers are well within the time. Coming to evaluation, Vrinda ma'am, we have completed only in the evaluation ma'am has taken, Toastmaster Vrinda has taken 8 minutes, 8 seconds extra time. Otherwise, every speeches and every evaluations are done within the time. Thank you. Back to General.
Thank you, Toastmaster Bharadwaj, for your detailed report. So with this, we have completed our tag team report. Now we have the listener, Toastmaster Sarika. So
Yes.
the virtual stage is yours, Sarika.
Thank you, sir. Thank you, General Evaluator. And I'm
Your
back.
voice is a bit low, Sarika, for me.
Now?
Yes, better.
Yeah. Thank you so much. Yes. Now I want to check How many of you listen to understand, not to reply? No? I have a few questions with me. I want to see how many attentive listeners are here. The first question is, what is the speciality of the month? Can I get a raise of hands?
Can you repeat?
Speciality.
Who is not audible clearly?
Oh, sorry. What is the speciality of the month?
You mean current month?
Yes,
Health
What is the
awareness.
speciality of the month, April?
No, you should
Who
not tell
ans-
answers. You should
Raise
raise hand.
hands.
Please raise
Now
your
500
hands, then
rupees
I'll
hand,
pick.
500 rupees fine to Noor.
That you please deduct from all the amount which you owe me now.
The minor
Okay.
rules are if you answered before raising your hands, then you will be disqualified.
No, you will be
So,
fined, not disqualified.
yeah. Toastmaster Ishita raised her hand. Already someone
Yeah.
told the answer, but fine.
Yeah, it is health awareness month. Yeah.
Yes, thank you. And the second question is, who used phrase of the day first? Who used phrase of the day first? Toastmaster Shraddha, speaker 2, please.
Dr. Mittal?
No.
TM Ishita then.
Toastmaster
Actually,
Manu.
yes.
No,
Who
grammarian.
said
the
that?
grammarian
Toastmaster
itself.
Grammarian itself. just to
Yes,
disclose that they have
that's
used
a
the
bit
first.
tricky question. First, he said introduced the word, so he used it. And now another question is, who played 3 roles in the meeting? 3 roles. And you need to say what are those 3 roles. Who played 3 roles in the meeting and what are they? Toastmaster Adi?
Yeah,
Yes,
I think Toastmaster Ishita played 3 roles. She was presiding officer. She took timer role once, and she's a TT master as well.
Actually, officially, one person took 3 roles.
Okay.
Toastmaster Ishita took a backup role. One person took 3 roles. Anyone? Toastmaster Bharatwaj, timer, please. Hello. No?
I also thought it is Ishita only.
Actually, no. Toastmaster Vikram sir played 3 roles as wordmaster, grammarian. It is a dual role, right? We all know about it. And another one is accountant. So he played 3 roles.
Now, grammarian is only one role. Wordmaster grammarian is one role.
Actually, we can say that wordmaster grammarian is dual role. I think so.
Okay.
In my point of view, yeah.
This
And
is also a tricky question.
I want to say one phrase. You have to find who said that phrase in the meeting. To sail the seal. To sail the seal. Who said this phrase?
Shahid.
Shahid.
Yes.
Yeah.
Our wonderful general evaluator said that. And the fifth question is, how many detox methods are there? How many detox methods are there?
4.
Which is mentioned by our keynote speaker.
4.
4, what are there? Yes, Toastmaster Adi, will you please say that?
Physical, mental, spiritual, and emotional.
Yes, that's absolutely right. Okay, the question is, what are the powerful, important things according to Toastmaster Amarnath? The speaker
Health and money.
Yes, health and money.
No. The
What?
powerful is don't spend it. Postpone your
Yes,
expenditures.
absolutely right. What kind of meme related to Toastmaster Shraddha got? What kind of meme Toastmaster
Leaving
Shraddha
the
got?
hall, entering the exam hall, leaving the exam hall.
Leaving the
Yes.
Chandramukhi.
Toastmaster Adi is a good listener. I can say that. The question is, how Indians measure distance? How
By time.
Indians
Time.
by time? Yes, absolutely. For champions, feedback is what?
Breakfast.
For example,
Breakfast.
yes.
And
Who
no one
said
is
this?
raising their hand.
No, please don't raise hands.
Actually, Toastmaster Adi, she is a very good listener. I can say that. And you are the winner of our listening session. You are a very attentive listener. And the third question, who will answer this? Then they will. Sorry.
Yeah, go ahead.
The final question is, who used phrase of the day 3 times?
Sujata Mittal.
Yes, again, Toastmaster Adi. With this, the listening session is done. And I can say that I absolutely everyone know that Toastmaster Adi is a very good listener, attentive listener. She she heard the meeting and listened the meeting to understand, not to reply. Remaining all of us absolutely, we listen the meeting to reply, not to understand. Please work upon it. Thank you, and over to you, General Evaluator.
Thank you, Toastmaster Sarika, the listener role. Okay, thank you. That was an amazing thing
But
you have did.
Sarika, she is not adhered to your rules actually. She was not raising the hand.
Yeah, disqualified.
Yeah.
Our
Yeah.
presiding officer said that disqualified. Okay, ma'am, as your wish.
No, just kidding. All right. Yeah.
Okay. So with this, I will just quickly give my general evaluator report and then we'll quickly wrap up. So as for our regular thing, we thought of start on time and close on time, but today I think both did not happen. The start time was okay, bit little, it's a 5 to 6 minutes delay, so that is agreed, but the closing time was too much. It is nearly 37 minutes we overrun our meeting. So maybe we need to look into this, and if the meeting is going beyond, why? Because going ahead in the current month, we have many keynote speeches will be coming up. So this will be a learning point for us. So if anything like a keynote speeches question and section is going beyond the stipulated time, we try to cut the other things. So it is good that we are conducting, but maybe some people may be staying here even it is overrun, but if we cut that, so that will be on time start and on time closing. That is one point from my side. And other than that, so rest of all the functionaries like prepared speeches, evaluations, and all the tag team report, that all went well, and I really enjoyed the listener session. This is the first time I have enjoyed this, and thanks to Toastmaster Sarika. So apart from this, everything went well. So with this, I will give the control back to our Toastmaster of the day, Toastmaster Adi.
Yeah. Thank you, General Evaluator Toastmaster Shahid, for your report and for the tag team and wonderful questions by listener Toastmaster Sarika. I'll try to adhere to the rules from next time. Now that we are coming to the end, I would like to hand over the meeting to Toastmaster Ishita, presiding officer, to give certificates.
Yes. Thank you all for staying till the
You
end.
still have the joke master, Madam President. I am missing my role, the in-house local joke master.
Okay.
Yeah?
Yeah.
Okay.
Yeah.
Okay. I'll quiz you on what jokes I asked last time. Okay.
Okay.
What do you call a lazy man in space? So no one was paying attention to my jokes last time. Huh? What do you call a lazy?
Noor, I was not there.
You guys are excused. Those who are present, guys, what do you call a lazy man in space? Procrastinaut.
This is very hard. You come up with very hard jokes, Noor.
Okay. You know the star in the sky which shines very bright, right? Cyrus. Sirius.
Serious.
Now, what is the name of the star next to it?
Not so serious. Not so serious.
Sibling of
Yeah, no, casual. Okay, how do napkins fight?
Tissue.
Tissue.
Yeah, very good. You remember. So good. See, I was about to tell a construction joke, but I'm still working on it. And also, I was going to tell you also a time travel joke, but you guys didn't like it before, so I'm not going to tell it. So how do you organize a space party? How do you organize a space party? You plan it.
Oh, planet.
First consult ISRO or NASA.
No, you
See,
plan it.
my jokes are so amazing that you guys have no option than to laugh. Okay. So, what type of what type of a book is impossible to put down? What type of a book is impossible to put down?
Hey, Noor, Vikram is leaving. We have to do the polls. He's gone.
Okay. A book on anti-gravity. Any book on anti-gravity. You cannot put it down. Okay. What is a seafood diet?
You see and you eat food.
Ah, good. See, Ishita is amazing. Now, what are the features?
I had that as my meme.
Oh, I see. I didn't see it. Okay, what are the features of the restaurant on a moon? What are the features of a restaurant on the moon?
Okay, people.
You can Google it also, no problem.
You will serve stones.
Great food, no atmosphere. Why did the Scarecrow win an award? Why did?
Because it is always outstanding.
Correct. What do you call a belt made with watches? What do you call a belt made of watches? A waste of time.
Waste of
WAIST.
Oh, okay.
I know. My jokes are amazing. Thank you, guys. Thank you all
Thank
for
you,
listening.
Joke Master. Okay, before more people drop off, let's do a couple of polls. I'm going to launch the poll of auxiliary role player. Okay. I know Vikram has dropped off, but whoever they are left, let's vote.
Those of you who want votes, please send money to me. I'll vote for you.
All right. I think I'll end the poll now. And one more is for the lead role player. Right. Please vote. I only received 5 votes. Please vote. Ding the poll. All right, let's announce the results for the
Sorry to interject,
best.
Sujata. I think we need to run the evaluator poll as well.
Yeah, but there was a disqualification in time, right?
Got it. Thank you.
Yeah.
But still, we'll run it, no?
We'll run it.
Yeah, she paid me the money already. So let's run it.
Okay. All right, let's run the evaluator poll. We went seriously over time today, but we couldn't stop the Q&A that was going on. Okay, I'll end the poll now. Okay, time for announcing the results. Shraddha has left. Any guesses on who was the winner for best
Shraddha.
speech?
Shraddha.
Yeah, it was Shraddha.
You said Shraddha is left, so you gave the cue out.
No. I wanted her to be. Oh, she's here.
She's
Okay. Yeah. The best.
Congratulations.
Congratulations, Shraddha, for best speech. The next is best TT. Any guesses? Who was the best table topic speaker?
Shahid.
Toastmaster.
Yes. Toastmaster?
Shahid.
Shahid. Yes, Shahid was the winner. Congratulations, Shahid.
Oh, thank you. Thank you so much.
Then our best evaluator. Any guesses for best
Vrunda.
evaluator? Right. It was very close. It is Toastmaster Noor.
Oh, thank you.
Very close. The best auxiliary.
Noor is the godfather of evaluations. So he should
No,
not be
no.
evaluating, competing.
That's true, Brinda. Yeah. When you're competing with Noor, tough luck.
I like money more than praise, Vrunda. Please send money. No praise.
अरे वायर किया मैंने मिला नहीं अभी तक.
नहीं मिला अभी तक. उसी के लिए ना आई एम फॉलोइंग अप विथ यू. पैसा किधर है?
Network issue.
पैसा.
हाँ नेटवर्क इशू है.
Okay. Best auxiliary role.
Auxiliary. Who are the auxiliary role players?
Sarika.
Sarika,
Sarika. Sarika.
Vikram, and
Sarika.
Bharadwaj. Sarika. That's correct. Sarika is the best auxiliary role. You bring a new vibe and energy in every time you take up a role, Sarika. So that's really awesome.
Well done. Well done.
So, and best lead role player. Again, it was very
Toastmaster
close call.
Adi. Adi.
Very
Adi.
close call.
Shahid.
Adi saw the
Adi,
results.
Adi.
Yes.
Adi.
Adi saw the
No,
results. Cheating. No cheating. Okay. Yeah, it is Toastmaster Shahid who is the best lead role player. You win 2 roles today, two awards today. Yeah.
पार्टी कब है शायद? दो
Yeah.
अवार्ड आ गए आज.
Party.
When is the party?
Thank you.
Yeah.
Yeah.
We want biryani, vegetable wala.
Vegetable.
Correct.
Sure, no.
All right. So I think all the. Oh, we forgot to do our picture thing. Oh, it's all
What is
right.
it?
Zoom master thing that Amarnath does with our certificates, right? We forgot today, but
Correct.
it's okay. Yeah, today was a very different session because of the keynote speaker and everything. We went over time and a lot of things had to be managed on the spot. So well done, everyone, for doing your roles. And with this, we'll now adjourn the meeting because we are way over time. So it's almost lunchtime.
She's feeling hungry. He wants to end the meeting. Jaके खाओ अभी.
End the meeting. नहीं, I'm here to talk, but किसी को भूख लगी है तो अब विक्रम तो चला गया अपना plan के लिए. We'll end the recording.